There are some other roles for the medical director. It has to do with policy, quality oversight. So the medical director will generally sit on the quality assurance committee. There will be a monthly meeting that will take place. In addition to that quality assurance meeting, there may be other things. I'll give you an example. We have a lot of private duty staff that work over at the Chateau at Moorings Park, where I'm the medical director. And we put together a task force, if you will, to work with the private duties to set some standards so that the private duty staff that came in, different from our regular staff at Moorings Park, would have some oversight as well as some guidance in terms of how to exchange information about the various residents, making sure that everybody followed some type of a dress code, that kind of thing, so that we did have standards that were in place. And then also mechanisms for better communication between one private duty person and our regular staff with each shift where a private duty person was working, as well as the changeover from one private duty person to another. Also things like identifying what their roles were. So some private duties are RNs, other ones are LPNs, there are others that are companions, so really don't have specific medical training like that. And so it is important to know which private duty has what type of role. Medical directors will also participate in any type of survey that happens through the state. So when the state comes in and visits the nursing facility, as they do generally on a yearly basis, the medical director may stop in, see some of the surveyors, talk to them about what's going on, see if they have any concerns about the medical care, answer any questions that they may have. And then once the survey is completed, we get a response of any citations that we may have gotten. If that happens, usually they're minor things, but sometimes they can be very serious. The medical director will be involved certainly in any medical issues that result from that type of a survey and making sure that any corrections that are in place are done to the satisfaction of what will be necessary in terms of optimizing medical care. There are some other roles for the medical director. The main thing for the medical director is making sure that any clinical personnel that come on board as a physician, nurse practitioner, or physician's assistant are appropriately certified, that they have the appropriate licensing, the insurance, things like that, and they work with the administration to oversee that process and provide credentialing for the facility to those types of providers who may come in from the outside. Other issues, for example, pharmacy issues, how we deal with the pharmacy. Usually the medical director is involved in that process as well. How ordering takes place, making sure that when an order is made, that it is actually carried out in a timely fashion and it is appropriately followed through. There's close communication all the time with the director of nursing as well as the administrator, and usually a medical director will be on site at least once a week, and oftentimes more than that. The other thing that is worth knowing is that in some circumstances, the medical director may follow some of the residents as an attending physician. Usually, the medical director is encouraged not to follow a large portion of the residents. And the reason for that is because the medical director has to have oversight for that clinical care. So you don't want the person who has oversight overseeing themselves. And so when you have a circumstance where the medical director is following a lot of residents, you oftentimes will have an agreement with an associate medical director who may or may not be credentialed in the facility to see residents, but somebody who can oversee the medical director who is seeing patients also, so that there is, if you will, a third party that doesn't have the bias of overseeing themselves. And so that is an arrangement that is sometimes made. In most circumstances, though, the medical director will only follow a few patients, a very small percentage. That gives them some insight in terms of processes, making sure that the staff are conducting themselves appropriately and interacting, and they don't have the conflict, if you will, of having to oversee themselves for the bulk of the patients. And even in those circumstances, we'll oftentimes have other physicians who will review records for the medical director, making sure that the medical director stays in compliance with regulatory oversight as well. Other things that the medical director will do have to do with program development. So if you have a dementia program in your facility, medical director has probably been involved in setting that up. And that will apply to other programs as well, particularly as it relates to medical oversight. So if you have, for example, I used to be the chief medical officer for a chain of long-term care facilities, and some of those facilities had a program for heart failure, where we had a special program where we had what was called an LVAD program, and it's a device that helps the heart to pump, and it is related to people in end-stage congestive heart failure and allows them to function a little bit better. Not everybody can participate in that program, but we set up a program like that for a number of our facilities, and the medical directors played an active role involved in that, and also interacted with the cardiologists that were working with that particular program. So that gives you some flavor in terms of what the medical director's responsibilities are and some of their role in terms of the nursing home. I'm sure that lots of you have questions related to the care or the oversight that takes place, and questions about the medical director per se. So we've gone on not quite a half an hour now. And I think what I will do is I'll hold things up at this point, and I may say a few other words to wrap things up, but let me hold things right now and just ask you in the audience if there are questions that people have about the medical director's role or anything that goes on in the nursing facility.
Well, I'm finding the questions. Dr. Gloth, I'd like to hear more about your best friend's approach in the chateau, and then you can be next.
So I will have to pay her a little bit later on for promoting that for us. The best friend's approach is something that is a program that is done at various places throughout the country. It's actually orchestrated by a gentleman named David Troxel out in California. And what it is it is a program that helps our staff to interact with folks that have dementia. And it gives us a mechanism to really more effectively work with folks who have cognitive impairment and work with various behavioral mechanisms to keep them engaged, to make sure that they continue to participate in life, particularly as their cognitive capabilities decline. It allows us to work better with the family. And it's a program where we can avoid using medications to try to address behavioral changes. And one of the problems that we see is that a lot of the medications that are out there that are used to control behavior generally lead to poor outcomes, sometimes even more frequent deaths among individuals that receive those medications. So at the Chateau, we have always emphasized less medication, more interaction. And so part of that interaction has to be learned by your staff. So if somebody says, and this group will be familiar with things like this, I've got to go see my mother, and you all know that that individual's mother's been dead for 20 years. The idea of saying, no, you can't go see your mother, she's been dead for 20 years, you know that that won't be a good explanation or a good rationale for somebody who's cognitively impaired and is absolutely certain that their mother is around, as certain as you are that the person next to you is actually next to you. And so training our staff to be able to have the right conversations that are acceptable and maintain the dignity of the individuals that have cognitive impairment becomes very important. And if we're successful with those types of behavioral interventions, we will also be successful in using less medication and in having better outcomes overall. And so that best friends approach does just that. It addresses these issues that keep people engaged and that are cognitively appropriate for the level of cognitive impairment that folks have, whether it be from Alzheimer's or any other dementia.